Welcome, doctors. Your day probably didn't start with patient care. It started with paperwork, insurance denials, follow-ups that seem to drag on forever. If that sounds familiar, you're not alone. Dr. Lacey was right there with you. Her mornings were dominated by administrative chaos, not clinical care. Her team was overwhelmed, her revenue cycle was unpredictable, and the paperwork was stealing time from the people who needed her most, her patients. So what changed? It was AI, quietly integrated into her revenue cycle, turning delays into efficiency and lost revenue into clean collections. Revenue cycle management is the financial heartbeat of every practice. But right now, it's bogged down: manual data entry, disconnected teams, long waits for verifications, and inconsistent reimbursements. And let's not forget the coding errors that lead to denials, or the countless hours spent chasing payments. They're financial leaks. In today's environment, AI isn't a shiny extra, it's essential. Take insurance verification, for example. I can now verify patient coverage in seconds, check for prior auth requirements, and autofill payer forms without the endless back and forth. It reduces front-end denials before they even happen. On the back end, predictive analytics flag claims likely to be denied based on your historical data, so your team can fix issues before submitting. That means fewer denials, fewer appeals, and more proactive billing. Natural language processing scans your clinical notes and recommends the correct captain codes. It scrubs for compliance, missing data, and mismatched codes, cutting down on rejections and saving your team hours of manual review. It highlights undercoded or missed charges and flags differences between what you're owed and what you're actually getting paid. It's like having a financial watchdog running 24/7 in the background. I can help there, too. It predicts which patients are likely to pay, sends smart reminders, and automates payment plans and follow-ups. No more manual calls or delayed statements, just a smoother, more efficient collection experience for both patients and staff. Big hospitals are already leading this shift. They're using AI to track reimbursement in real time, accurately code high-volume procedures, and ensure nothing gets missed. But you don't need to be a hospital to see results. Even small practices are using AI to shrink billing teams, cut operating costs, and boost revenue. Many are seeing positive ROI in just a few months. And when you pair AI with the right support team. At Staffingly, our virtual medical assistants work directly inside your systems, fully trained on your EHR, payer rules, and AI tools. We manage the entire RCM workflow, from verifications and prior auths to follow-ups and appeals. Real people, real-time solutions, and full 24/7 coverage to keep your practice running. You need a smart team behind it. The question isn't whether AI fits into your revenue cycle, it's whether you're ready to stop wasting time and start reclaiming it. If you're done starting your mornings with paperwork, let's talk. Visit staffingly.com or reach out to our team.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.